Do you think that the UK needs to be doing more when it comes to actually distributing these vaccines?
Well, I think that there is a fairly significant expansion of the vaccine rollout going on, but certainly in order to, for example, meet the government targets, which is to vaccinate many millions of people over the next few weeks, we do need to expand it further and to get creative, to use new spaces. They're asking for volunteers to help with the administration of the vaccine process, vaccination stewards, as they're calling them. There also are paid job opportunities to become vaccinators for other healthcare members of staff who are wanting to join in. That could also have been done weeks and months ago. I think your colleague from Denmark just now mentioned the need for preparedness. And I think that's one area where we could have been more prepared here in the UK with regards to vaccination rollout.
Now that we have begun the vaccination of the most vulnerable, when should we start to see hospitalization rates meaningfully decline?
I think we will start to see hospitalisation rates decline in a few weeks' time. I think after Easter, the picture for the UK and probably a few European nations will start to look much brighter in terms of pressure on the health services, but it will be towards the mid to late summer as a minimum before much of the non-vulnerable population has been vaccinated and sort of life can start to resume some level of normality.
This new variant spreads. If you look at case numbers in the UK, even back at the end of November, before the second national lockdown was lifted, we already saw case numbers meaningfully increase when people were largely staying at home. And we understand that it spreads a lot more easily than the previous strains. Is there something structurally different about how this new strain spreads that we don't yet understand that perhaps would help us better control the virus as we await the mass rollout of these vaccines?
Well, we've still got the genomic scientists looking at how this virus, this new variant operates compared to the old variants. There's theories around that it can enter the human cells a bit easier, or that you have a higher viral load, and thus it's easier to transmit. So that's something that colleagues will be looking at. So we will find out more information about that over the coming weeks. But clearly, as you say, numbers were increasing in the UK from late November onwards. Cases certainly would be going up quite significantly anyway over the last couple of months here in the UK, but the new variant has enhanced that increase. So our graphs have been on quite a steep trajectory upwards, which has been very worrying. And we're now seeing that in terms of levels of significant hospitalizations and deaths from COVID-19.